what the procedure is, the goals of the procedure, when to consider the procedure, the key anatomy involved, steps of the procedure, including the implants and hardware used, as well as the risks. And then we're going to go into a deep dive of comparing arthroplasty versus fusion, and then the key takeaways. So what is this procedure? So like we established, it's very similar to ACDF. So it's just the surgical removal of a damaged disc in the neck. The discs here are in blue are a rubbery material, and they get disease damage from a bunch of different reasons. So it's used when the neck or arm pain from a damaged disc is not improved with non-surgical care, like physical therapy, oral medications, or injections. And so it's performed very similar to ACDF through the anterior, through the front of the neck. Surgical approach, which is minimally invasive and doesn't affect the spine as much. And so the point of surgery is to decompress that affected nerve root and or spinal cord. And like I said, that can happen for a bunch of different reasons, like aging, trauma, a lot of different reasons that can happen. So it's a placement of an artificial disc into the damaged disc space to also maintain that height, similar to what we were talking about. And so it's designed as a motion-preserving alternative to the ACDF surgery. Go on. Okay, so goals of the procedure: to relieve that neck pain and arm pain, to keep the movement at the treated level of the spine. So with the artificial disc, not like ACDF, which is fusion, which fuses the bone together, this allows for movement. So instead of being immobilized, you can fully move and just have a normal spine again, basically. So support more natural movement of the neck compared to the ACDF surgery, and then remain normal spacing, and then reduces extra stress since that tension isn't going above or below where the ACDF surgery usually would be.
All right, so now we're getting to when to even consider maybe a cervical arthroplasty. Very high level, but you may experience like neurological symptoms such as numbness, tingling, or weakness in the arms or hands due to nerve compression. You could even have like persistent pain, which is the chronic neck pain that does not respond to physical therapy, like medications or even like non-surgical treatments, or even like spinal cord compression, which is like you could have difficulty walking, balance issues, or even like hand dexterity problems.
So same thing as an ACDF, right? Same patient?
Mm-hmm.
Maybe?
All right, so now we'll look at kind of getting into like the nitty gritty of like the key anatomy involved, and as I talk about different things, you can kind of like see on the images, just it's easier to picture. So you have the anterior neck corridor, which is working between the carotid sheath and the trachea and esophagus. You have the cervical spine structure, which includes the vertebral bodies, implants, and the using processes. You have the intervertebral disc, which is actually what is removed and replaced, which includes the annulus fibrosus, the nucleus pulposus, and the posterior longitudinal ligament. It's a mouthful. You have the neural structures, which is what is decompressed as well. So you have the spinal cord and nerve roots, and then you have the motion preserving structures, which is the fossa joints. Let me just give you a really good idea on kind of like what we're actually talking about. I know it's kind of like a lot we're not really familiar with at all, so really good idea of what's going on. Now we'll get into like probably the most important part, which is the steps of the procedure. Very high level again, but first is the patient positioning and the level of confirmation. So the patient is supine, meaning laying on the back, and the neck is slightly extended. And then the next step is the anterior neck approach. So there's a small incision made in front of the neck. You separate the soft tissues. Then you move the carotid sheath laterally, and the trachea and esophagus immediately. And then usually at this point, the cervical spine is now exposed. The next step is usually the discectomy and the decompression. So you remove the diseased disc, you clear any bones first, and decompress the spinal cord and nerve roots. Step 4 is where usually the implant preparation happens. So you remove cartilage, you preserve the bone for implant stability, and the disc base is restored to proper height. This step is probably one of the best part of it all. It's the implant sizing and the placement. So the tri-implant is used to choose the size. The artificial disc is now inserted under fluoroscopy, and the alignment and motion is checked. And lastly, the best of it all is the closure, where the retractors are removed, the incision is closed, the nerves are decompressed, and motion is preserved. And hopefully you have a very successful surgery and even happier patient.
Real similar to that ACDF.
It is.
When you guys listen to their
Yeah.
Like a lot of
presentation.
things, I was like, we're just gonna say,
Yeah.
like, the exact same thing.
Yeah.
Literally the exact
Yeah.
same thing.
Yeah, I mean, the only thing you're not doing is like just putting a plate on the front or any
Mhm.
screws, like you're not rigidly putting it in there. But, you know, for the layperson, like if you're explaining this to your family member or something, I just think of this as like, it's the same thing as an artificial hip or a knee. It's a motion device, right? And we're putting it in a segment that had motion before, and hopefully restored motion. And then, yeah, there's competitive devices up here now, again, Brandon, but that's
All right, so now we're getting into some of the implants and hardware used. So the cervical arthroplasty replaces obviously the damaged cervical disc with an artificial disc implant that preserves motion instead of using the spine. So there are some like common FDA-approved implants that we wanted to include and share with everyone. So you got the Prestige LP cervical disc, which is like a titanium alloy with ball and truck design. And you have the MoEC cervical disc, which is like a mobile polyethylene like core. It allows motion at the I2 levels. And then you have the Pro Disc C, which is like the ball and socket design. And it's like with cobalt and chrome like end plates. And then you have the simplified cervical artificial disc, which is like ceramic materials and it's more like MRI friendly. And then we'll look at the risk of the procedure. There's always risk with every procedure. So some general surgical risk can be like infection, bleeding, and anesthesia complications, and then blood clots as well. But you also have like actual specific procedure risks, which are like nerve injury and spinal cord damage. You could have difficulty swallowing. You could have hoarseness, implant migration or loosening, heterotopic ossification, persistent or recurrent neck and arm pain, or need for revision surgery, similar to the ACDF. So you kind of a similar risk as well.
Yeah, and looking at comparing the arthroplasty surgery to a fusion surgery, these are some of the key differences that we found. The motion at the level of where you are, the damaged disc is preserved, and then with ACDF surgery, it's completely eliminated. So you cannot move where that disc is placed. And then the segment stress is lower with the arthroplasty surgery, as I talked about, because it's less tension above and below where you put that disc. The reoperation risk is lower long-term with the cervical arthroplasty because of that, because of the able to movement, being able to move, and then higher long-term with ACDF surgery, faster recovery with cervical arthroplasty, and then the major difference is the artificial disc versus the bone graft or plate that we saw in the surgery before us. So the key takeaways are that cervical arthroplasty removes that diseased disc and decompresses neural structures. Unlike fusion, it preserves motion at the treated spinal level. Appropriate patient selection is crucial when considering somebody for this surgery. And then motion preservation may reduce the long-term stress on the spinal segments. This procedure represents I think, an evolution in spine surgery because of the ability to be able to move while still having that high success rate. So yeah, that's awesome.
Yeah, what was that last picture? Did you recognize that? Is that just an AI type thing?
It looks like it.
Yeah. It looks pretty cool. I don't think of an image to it.
With all that being said, why wouldn't everybody just get that type of procedure versus a fusion?
I mean,
Curious of your thoughts on that. Anybody?
I would say maybe like the cervical arthroplasty is a new procedure, so maybe someone wouldn't trust it. They would go with what's always been done. Maybe they just maybe don't trust it. That might be a preference deal. As well.
That's a
patient,
pretty good answer.
maybe patient needs and kind of what the problem is, why they have a damaged
Pretty good
disc.
answer too.
Yep.
How different are the finances on both?
That's the third answer.
Asking all the right
Yes,
questions.
Guys,
it's relevant.
Y'all nailed all of it, right? I mean, patient anatomy, how I was trained, and then the finances. Surgeons make less on this procedure. Now, it's changed over the years because it is new, right? So it's getting closer to ACDF, but most surgeons are like, make